This is my journal article review number 1. The title of my journal article is Knee Injuries and Associated Risk Factors in National Basketball Association Athletes. There are several authors. I will not pronounce their names because I do not want to completely demolish their names. This article was published in October of 2022. So I mean, it's not too old, but it's also not like a 2023 or 2024 article. Introduction. Authors in this case wanted to identify risk factors with structural knee rates within the National Basketball Association, also known as the NBA, in relation to the number of games missed. I selected this article specifically because it analyzed the demographics of knee injuries within the NBA, with identifying the things like age and intensity level of the NBA in relation to common knee injuries. For my topic for the final project, it analyzes the kinematics and kinetics between novice and experts in the sport of basketball, specifically focusing on injury prevention with joint loads and stress along with movement patterns. For data collection, an online database was used to assess missed games for players due to injury and description of injury to determine which knee injuries caused more missed games. The methods used, the data collection used the Pro Sports Transactions, which is a public website. Anyone can access it in order to find any information on any NBA player. And this was to identify the NBA players and their injury descriptions between the 2015 and the 2021 seasons. This website also includes any demographics, player statistics, and injury characteristics that are recorded for the statistical analysis. So this website really has all of the things that any person interested in the NBA at all wants to like track anything, anything like that. This website is very good with that. For the results of the article, authors determined that there were 740 knee injuries reported within 6 NBA seasons. Most common injury was a knee contusion and then followed by inflammation. Also included a small amount of anterior cruciate ligaments, also known as ACL injuries, as well as cartilage and meniscus tears. In players over 20 years old, structural knee injury rate is at its greatest compared to someone who is in their younger age playing. They found that age is a key risk for structural knee injury, along with greater weight, experience, and minutes played in both practice and games, which all feed into knee injuries and lower extremity injuries in general. The conclusions, so 21% of NBA players sustained a structural knee injury due to the associated risk factors, and it was positively correlated with an increased number of missed games after knee injury. Shockingly, a player's efficiency in a game was associated with a decreased risk of injury. Future research can be continued on this subject to aid in injury prevention for the specific demographics of age, weight, etc. For NBA players in comparison to high school athletes. I could use this article in my project to highlight key risk for knee injuries within professional players compared to amateur players. For my analysis, overall, I think it's a good article for someone who wants to statistically report on the subject of knee injuries in NBA athletes. And in my case, it was good for highlighting the specific characteristics of age, weight, and experience in the sport in relation to knee injuries. However, for my specific topic, I don't think it's a very good article to use since we're not analyzing the joint load and stress in relation to the kinematics and kinetic side of things. If I were to change anything about this article, I would have added a test done on the athlete to determine their level of force brought onto their knees, which feeds into their injuries. And I think analyzing it in this perspective would have been more helpful towards my project, looking at it more in a velocity, acceleration, and force impact on the knees, rather than just reporting however many statistical players encountered injuries overall.